Good morning and welcome to Sirona's very first live stream where we have a possibility to watch two surgical applications done with our Zero Laser Blue. Welcome to the audience worldwide that are sharing this experience on the internet, at their computer monitors, at their mobile devices. Welcome to this. Also welcome to the audience here at the Villa Fenaroli. There are 28 dentists from 13 countries from all over the world, and they are enjoying to see this clinical work being done and performed live here. What are we going to see here? We have two cases prepared. One is a frenectomy, and the second is a fibrotic lesion on the tongue. One remark concerning the further procedure. I will hand over to the clinic in a second, and Giuseppe Iaria will perform the treatment, as well as he will do all the explanations of what he's actually doing. So when there are questions, we have a question and answers round after the treatment. And also from the live stream, you have the possibility to write us those questions. So welcome again, especially to our clinical host at the private clinic of Giuseppe Iaria. And Giuseppe, are you ready for us?
I'm ready.
Perfect.
Perfect.
So please, go ahead.
Okay, down. Okay, great. So we are ready to go. This is a case of frenectomy. Frenectomy is a common procedure in the field of oral and maxillofacial surgery. The advantage of laser surgery includes higher precision when compared to surgical tools, which results in less pain, less bleeding, post-op swelling and scarring. The procedure, as you can see, is not time-consuming, so very, very fast, without any problem during the procedure and after the procedure, easy to perform, and no suture are required, so no drugs after the procedure, which decrease the risk of post-op infection. The Zero Laser Blue is very, very selective. And we want to use this selective action for this treatment. As we said, as we heard by Professor Brown yesterday, we can use free wavelengths, and the 445 is nanometers wavelength is more selective because is only absorbed by hemoglobin and melanin, and the absorption in water is quite inexistent. No absorption in water at all. So we can use this selective action to control the bleeding at the end of the procedure. It's light, the light of Zero Laser Blue transmits energy to the cell, causing warming, then welding, then coagulation, protein denaturation, and you can look at the result. Drying and vaporization without or very low increase of temperature to the surrounding tissue. So yesterday we spoke about the difference from electrosurgery and laser. They are totally different. Using an electrosurgery, you use a flame in the oral cavity. You use energy that is given to the target tissue, but also is given to the surrounding tissue. So when we are in front of a thin biotip, we can cause great damage, and we can cause a great possibility to retraction of the gingival recontour after a procedure using an electrosurgery device. Instead, the laser is very, very selective. I love laser. My love is during my work. I use a lot of different lasers because each of these lasers has a very selective action. So you can treat some tissue components without causing damage to the other components. So we can use laser only for our tissue treatment without increase the pulp temperature, for example, using an erbium YAG laser, or we can use soft tissue laser, such as these, to give energy only to create hemostasis, only to biostimulate the field, or to decontaminate without causing increase of temperature and damage to the surrounding tissue. So these are very, very selective tools. When I speak about laser, I always speak about the car races. If you use a Formula One, the best for me is Ferrari, not Mercedes, but I know both. You use a very interesting tool, very selective of the car, but it's not possible to go with a Formula One to a normal road because of the eye of the car. Instead, the rally car can also go in the normal roads or street, but it's not possible to do a race with a Formula One because it's faster and faster than Formula One. So we use selective device to do different procedure. I want to do my best to Carlos here from Le Mans. He knows very well what I'm saying now. But about our treatment, this is a frenectomy, and we are working with this very interesting device. It's very interesting because we can use 3 different wavelengths. The 970 nanometers is useful when we have to treat very fibrous tissue. So if I have to cut, for example, an area in the retromolar area, I prefer to use a 970 nanometer. The 445 is a better wavelength to have the maximum control over bleeding. So in surgery is the best wavelength on the market for sure. And the 660 is the best for to biostimulate during the before and after the procedure and during the healing process. So this is a very interesting tools that can give us different possibility to treat the patient in the best way. So we are ready to go. We used lidocaine cream, and also because the patient was scared about the cameras, the team around, I perform a little bit of infiltrative anesthesia, but normally I do not do this. I only use lidocaine cream. So we are ready to go. The first choice is okay. I'm ready to go. I have only to choose the preset. The first choice, as you can see, for me, I preset in my favorite the 970 nanometers to start. I will use 2 watts of energy in a continuous wave. Okay, so you have to push only the end piece, to use only the end piece, and we are ready to go. Okay. We are wearing the eyeglasses. Laser is ready. Open your mouth, please. We work in contact mode. Look. 10 seconds from one side. 1, 2, 3, 4. Is a very gentle treatment. 5, 6. Look, my assistant use a gauze because we are in contact and some debris can cover the tip. So look, we are cutting and cutting with different layers. Use a gauze. Thanks. And from the other side, sorry, I'm working with my microscope, and so I change the position. 1. It's better to be perpendicular to the tissue. 2, 3, 4, 5, 6, 7. Please goes. 8, 9, 10. Okay, great. And now 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Look at the position. Okay. Look, please. We can open better. Okay, and here 1, 2, 3, 4. Look at the fibrous tissue. So we can also open a little bit there to remove the connective tissue. Okay, please. Good. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We can go on the palatal side to do the same. No, sorry, goes. Clean my fiber, please. Thank you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. To remove any connective and fibrous tissue, look at the result. This is the first result. Look, but now we change from one wavelength to the second wavelength, the 445, to control the bleeding at the back. So we go to the other procedure, sorry. We change to the second setting, 445. I set it only 1.8 watts in a continuous wave mode. And we are ready to go. Clean the fiber, please. So this is another wavelength. Look at the difference from the first to the second. I use the laser. Okay, I'm sorry. I have to. Okay, to put the laser ready, and I use the laser in a non-contact mode now. Look how fast, and look how it's possible to cut the tissue without any contact, without the maximum control of the bleeding. And we are quite to finish. A little bit. Okay. 5 seconds. Only 5 seconds. 1, 2, 3, 4, 5. Okay, great. This is the result. Totally absent is the contraction of the tissue without any bleeding. Please, a gauze bagnata con soluzione fisiologica. Ok. Hai dolore? Now, adesso? Dolore?
No.
No. Any pain now? Te l'ho detto in inglese. Hai dolore? Tu rispondi no. Io dico any pain now. Any pain now?
Cosa vuol dire?
No, no at all. Great. Great. Ok. La garzina. Dammi. Ok. So, we use only a gauze only to remove some debris and look at the result. It's very clean without any look around. There are no inflammation, any change of color of surrounding tissue. That means no inflammation surrounding the surgical zone area. So look at the other side, and it's totally cut. Okay, no suture, no bleeding, very fast. The second treatment is in the lower side because she has some problem with this frenulum. She has sometimes swelling, sometimes a little bit of pain. So we remove also this frenulum. It will be faster and faster. And in this case, we will use only the 445. Look at the speed of the cut. Please, give me quel labbro, bene? Okay. Uno, due, three, four. I change the side. 5, 6. This to the gauze clean. 7, 8, 9, 10. Also, you can also work on the muscle fiber without any problem. She has no pain at all, not only now, but also during all the phases of the healing process. Look at the final result. Very, very clean, without any... look, any area with carbonization tissue, that is only white. So we have an area with hemostasis, denaturation of the protein, but look, no carbonization at all, or a little bit on the margins. But it means that the increase of temperature was the minimum. Look at the result. Okay, great. We have finished. Do you have pain here? Hai avuto dolore qua?
No.
Ok, grazie. Thank you so much. Benissimo. Puoi alzarti, a posto. Poi adesso puoi sciacquare, andare a prendere un bel gelato, non devi prendere niente. Before the treatment, Eleonora, please, no, she has a piercing here. I remove the piercing in order to avoid any reflection of the light. And now you can put another time the piercing if your mother agrees. Se tua mamma è d'accordo, ti rimetti il piercing. Ciao, ciao. Ok, thank you.
Perfect, Giuseppe. Great job. Thanks again. That was the first. Now, they are going to prepare the second case now. Are there any questions from the audience?
The 97 and
stand up, please.
Good morning.
Good morning.
Yeah, and understand why he used first the 90-70 and after the 40-45. For the 40-145.
Giuseppe, did you get the question?
Yes. It's very interesting why I prefer to use before the 970 nanometers instead of 445 in this situation. Because as Professor Brown also showed yesterday, and we know very well, using the 970 we have a little bit absorption also in water. So the transmission of energy to the tissue is more gentle, but only on the fibrotic and tissue. So when you have always to look at the color of the lesion. If the color is red or red-blue, the best solution is 445 because there are vessels, there are blood. So we will use the 445 as the first choice. But if I look at the area, the target area, and the color is white, I can think there are connective fibers and fibrotic tissue. So in this case, I prefer to start with the 970 and then I use the 445. At the end, when we will have the other tip, for sure, we will use the 660 for the biostimulation, the biomodulation during the healing process. So, we have 3 wavelengths. We have to understand which is the better. And to use all the wavelengths in order to give always the best and the best rate of energy to the tissue components we want to treat.
Thank you. Is there any other question from the audience? No questions so far? Okay. I know that we had a couple questions before we started the live treatment from the internet. And I just want to repeat that because it was sent to us a couple days ago already. So Giuseppe, could you please tell us the difference again between the healing time using a laser and an electrosurge or a similar device?
Yes. If you use the right rate and the right wavelength, you can expect similar healing process. And there are a little bit difference in some phases of the healing process. You know that diode laser tends to produce more pronounced changes than conventional scalpel surgical procedure due to a little bit of thermal tissue damage, with corresponding greater inflammatory, creating and delay in tissue organization only at the initial stage. So only at the initial stage, if you look at the result in the surrounding tissue, you can look at some different color due to a little bit of increase of temperature in the margin. But only in the initial stage. But if you think that the healing process is given by 4 different phases: the hemostasis, the inflammation, the proliferation, and the maturation process. And you know that we have hemostasis since we finish the procedure. So we do not have any delay in this first phase. During the hemostasis, white platelets play a crucial role in clot formation, and we have a clot in the same moment we perform the procedure. The inflammation is the phase in which the inflammation debris the injured tissue. So this second phase is a little bit longer using a laser than a conventional or scalpel surgery. But it depends a lot on the setting procedure. So if you use too much power, the injury is more and more. If you use a continuous wave mode, there is a continuous transmission of energy. So if you use a super pulse mode, you have also the possibility to give relaxing time to the tissue. And I know that in the audience there is also my friend, Klaus Nagel, that know very well this concept. And also I want to give my best to the other friends in the audience, to Scott, to Alfred, and to the other friends in the audience now. But so it depends on the rate, on the energy, on the fluence. As the fluence is the energy that we give to the area, the target area. So more is the fluence, more is the work of the laser, but more is the increase of temperature. So we have to choose the right energy setting, the right power setting, and the right wavelength. There are other variables that are the focus, no? If we focus or we touch is different, because if we work in non-contact mode, we have to know that each wavelength has different angles emission. It's not very collimated as we think, but there is a little bit angle in the transmission. So if we work not in contact, we work in a larger area, but the fluence decrease. So, the result depends of multiple variables, and we have to keep in mind that is starting using a laser. You have to know this physical concept, but the best is to use always this suggestion. Use the minimum energy and power setting to have the result. And then if you do not have result, you can increase. So it's not important to go faster and faster, but the most important is not to damage the tissue. So use only the energy you need for that procedure. The first. The second, look always at the tissue, the change of color. If you have some black debris, you have to understand that it means a carbonization, too much temperature. We have carbonization when we increase the temperature of 250 Celsius degree. Too much. We do not want to look at result black. No at all. We want only to have the cut, the ablation of tissue, the hemostasis, or the other results. But if you look at something that is black, is carbonization debris. So you have to remove and to decrease the power setting. So, you know, we have hemostasis, inflammation, then we have proliferation and maturation. But the healing process is similar in time if you use a normal scalpel or you use a laser. So you only have to expect similar timing, but during this time, the patient has no pain at all, no problem. In most cases, you do not have to put suture, so you do not have any contamination of the field due to the presence of a suture. So no drugs, no pain, no swelling, no problem during the healing process. And this is very important for the patient, but also for us.
Perfect. Thank you very much, Giuseppe. Actually, you answered the question that I have here on my card already, the advantages of the laser treatment in comparison to the Scalpel. So no sutures, less pain. Thanks for that. Giuseppe, how much time do you need for the preparation of the second patient?
Only 5 minutes, no more. Do you have a coffee break, or I can go ahead?
Pardon? There's no question right now, so if we can proceed, that would be perfect.
We are quite ready. Only 2 minutes. Only come with me.
So the second treatment that we are going to see is the fibroma on the tongue, 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 fibroma.
As you can see, there is the video now. Okay. Are we ready? Good. Okay. As you can see, in this case, we use only lidocaine cream. We can remove. Prendi una gazza. Gli occhiali. We wear eyeglasses. Rimetti il microscopio. My microscope, please. And sorry. Okay. Un pochino più su. Bravissimo. Ok. No. Che questo magari dà fastidio. Is it okay for you? For the camera? Okay. The focus is okay? All is okay? Huh? Yeah. Okay. Great. La pinzetta chirurgica. Okay. We change the tip, they are disposable, so we are ready for another treatment. We change the set, and the same, I will start with the 970, and then I will use the 445. So, this is a fibroma on the tongue, on the tip of the tongue. Look. Is a lesion on the tip of the tongue. We have to consider it as a lesion now, and we want to take this lesion to analyze after the procedure. So the line of a cut will be only in the healthy tissue, not in the lesion. So I will stay 1 or 2 millimeters far from the lesion when I cut this lesion. This is very important, as this fibroma is a common benign scar-like reaction to persistent long-standing irritation in an area of the oral cavity. It's also known as traumatic fibroma or fibrous hyperplasia or fibrous nodule or oral polyp. It's usually due to chronic irritation such as biting of a cheek or lip against a rough tooth or dentures and other oral prostheses. It's typically clearer than the surrounding tissue. Look. Apart from the feel and appearance, oral fibromas do not cause any symptoms to the patient. It develops over weeks or months to reach the maximum size, such as this, and normally is a solitary lesion. If you look at many lesions, you have to think also to other possibility. Oral fibroma doesn't develop into oral cancer. But, however, the excised fibroma specimen has to be sent for a histopathological analysis in order to be sure that it is a fibroma. Diagnosis and treatment of a fibroma requires excision with 1 or 2 millimeter mucosal safety margins. It may recur after surgery if the source of irritation continues, so you have to remove the source of irritation. And we will use the 3 different wavelengths of this laser in order to give the minimum energy to the surrounding tissue, in order that the histopathological analysis will be sure without any possibility to consider any burning finishing line or margin. So it's very important not to burn all the tissue, but to do a perfect excision of a lesion. So we are ready to start. I can use my microscope. Inside my microscope there is a lens in order to work without eyeglasses when I work. So we are ready to go. Okay. We can use this in order to curve the fiber, or in this case I will use the straight teeth. So we are ready to go. When we will have the new tips for the 660, we can also work in non-contact mode like I'm doing now, in order to give an antalgic effect to the surrounding area. Look, I'm not touching the surface at all, but I'm only working to give antalgic effect, and then I go to the area. Okay, a little bit of air, and now we are starting working around the lesion. Okay, the only problem is to take the tongue very in your hand. Okay, great. Any pain on or discomfort? Hai dolore o fastidio? Pochino, pochino. Only a little bit. If you have pain, you can use your hands. Se hai dolore, alza la mano. Ok, adesso devi tenermi qua la lesione, così, please. Vai. Vai. Too much energy. Only this area you can remove easily. Only from this side. And then, there you go. Ah, sorry. Oh, great, great. 5 seconds. 1, 2, 3, 4, 5. Tieni un po' tirato fuori. Tira un po' di fuori. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay, pulisci, clean. The other side. 1. Tirami fuori per favore. Tirami fuori. Ok. 1, 2, tira fuori. 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, please. And now that we are ready to take, we change the laser, and I will use the 445 in order to have a clean area without any bleeding, because we are working on the tongue and we can expect also some bleeding. So, prendila bene, sì, prendila bene. Only a few seconds. 1, 2, 3, 4, 5, ok, e dall'altra parte, prendila bene. 1, 2, 3, 4, 5. Other 5 seconds and we will finish. 1, 2, 3, 4, 5. Good. Look, any bleeding at all. Look. Prendi una garza, we put inside the box, mettilo dentro. Ok, great. And una garza, it goes to clean the area. Abbiamo finito, tolto, benissimo. È very pulito, without any bleeding at all. So, look. Ok. No problem. No, not. We do not have to use any suture. No inflammation tissue around the lesion. Look. Do you have pain if I do this? Hai dolore?
No.
No? Now, do you have pain? Pain e dolore? No. Great. Thank you so much. Okay. And also the second treatment was done. Great.
Perfect. Thank you. Thank you very much, Giuseppe. That was a great procedure as well.
So, look at the patient. Fatti vedere. After the treatment, without any problem. Okay, thank you so much. Thank you.
Thank you, Giuseppe. Great procedure as well. Unfortunately, we had some problems with the stream here, but nevertheless, I think, or hopefully, the stream to the people worldwide went a little bit better. All right. Do we have any questions here in the audience? None so far. I have one question from the internet that came here. A German doctor, he asked about the penetration depth of the laser.
About the penetration of this light, we need more studies and research about this, but you can also look at some research did at the moment, and there is a very interesting research done by the University of Leuven in Belgium on the penetration of the light in the apple. And the result was that the 445 nanometers light has a penetration less than 2 millimeters in the tissue. So we have to expect from 0.2 millimeters. 0.2 millimeters in the tissue. There is the absorption. You know that the effect on the tissue are not only absorption, but there are also the transmission, the diffusion, and the reflection. But the area in which we will expect absorption is only 0.2 millimeters. So when you work, you can work layer after layer, with a great control of what you are doing. Using a normal scalpel, it's easy to go in a wrong way. Using a fiber, it's more easy to control your device, your hand. And always, I will expect hemostasis. So also in my other surgical treatment, as I want to open a flap, for example, as I want to do an apicectomy, or I want to do a sinus lift, always I prefer to use a laser to open a flap instead of a normal knife. So to us, it gives a lot of benefit. Other questions?
Yes, perfect, thank you. There's another question coming from Canada. It's more generally, can the laser be used for periimplantitis?
Okay, great question. last works, imperimplantitis, appeared on and published in PubMed on the use of lasers, of diode laser for the treatment of perimplantitis, give us very interesting result. It is possible to use light in order to go through the skew of an implant better than other instruments. You know that when you have not only mucositis, but a perimplantitis, there is the need to open a flap to clean very well the surfaces, not only the margin, but also the implant surfaces, and is very, very difficult. It's not possible to clean an implant only using hands instruments. We need something more, and something more is the light. The light can go around and around and can be reflected, but it will be possible to add efficacy to this treatment using some chromophore, such as endogenous green or other chromophore, in order to have the transmission of the light also given by the dye on all the skew. So I think that in the next future there will be a lot of publication on this field, the use of laser for PDT therapy, so photodynamic therapy. And endogenous green combined with laser can also give us oxygen molecules, able to give oxygen to the anaerobic biofilm. And so we have an action that is done by the temperature increase that can give a good result on the gram positive, and also the emission of oxygen then can give result on the gram negative. So this combined action could help us a lot in this situation. I used the laser in this way since the last 2 years, and I had great result. So we need more time to have more cases treated, to publish the result, and to be sure that this procedure is better than others.
Okay, thank you, Giuseppe. Are there any other questions? If not, I want to thank you again, Giuseppe. Say our warmest regards to the patients. And I would like to tell you that we will have a recorded version of the live stream. I think on Monday it will be in the internet. And thank you for sharing this impression, sharing this experience. Thanks again to everyone. Bye-bye, Giuseppe. And bye-bye to all out there.